So that's now 13 years, and a lot has changed. I mean, think of the conference. The first time we met, we were 70, and now we're 700. It's a vibrant community that, on the first meetings, or the very first meeting at least, we discussed the theory, the why. Why is value-based healthcare important? Now it's the what and the how. It's a community of practitioners, people who are doing stuff, changing and trying to learn from each other by coming here. So that's a big change. We've had a tremendous increase in the number of scientific publications on ICHOM, where ICHOM metrics are used for research purposes and then, change science in the provider sector. That's a big change. We've had an increasing clarity on what ICHOM means on a system level, that it's not a theory for providers and how to change, but it's in fact a model for how to improve healthcare systems at large. And I think that's hugely important, because that ensures that we align all the pieces in our healthcare system to the patient and improving patient outcomes. There's also been a lot of engagement from big multinational organizations. The World Economic Forum, the OECD, the World Bank, and many others are advocating value-based healthcare today in a way that was not taking place then. So there's a massive change, I would say. But still, it's just the beginning. We have so much more to do, and I think the meeting today illustrates, and yesterday, the importance of scaling, taking these ideas on islands to a national level. There are examples now of nations who are actually making value-based healthcare and the system framework to the national strategy. And they're changing all these pieces to go in this direction. Now, to me, that's maybe one of the most inspiring, the prospect of scaling. I think the fact that we have growing crises in healthcare, that the old paradigm of optimizing for processes and judging hospitals by compliance to guidelines, etc., is not holding up, and the crisis is getting worse. And I think a lot of people are seeing that the patient centricity is a much better way to think of the focus for professionals, the focus for insurance companies, the focus for staff, but also the way in which we can eliminate waste. It becomes a positive way to eliminate waste, to stop doing what doesn't help patients. So I think the crisis in general in healthcare, and with that the awareness of value-based healthcare as an answer to address the crisis, I think that's number one. Number two, I would say, and that may be self-serving, but I do think the standardized measures, that across the globe there is a reference for what is it we should be measuring. And that's important, first because it helps, guides people into what the leading thinkers, academics, patients and others have agreed to measure. But it lays the foundation also for benchmarking, for learning from others, because you have compatible data. So I think those two, the fact that the external world, the old model isn't working, and the fact that we now have these references, that this fantastic community of 1,300 individuals have developed over the years, that lays the foundation for us to learn from each other, to be able to compare, find best practice and find waste so we can do what matters to patients.